Well, good afternoon, everyone. Thank you for joining us today, and thanks for your patience as we are navigating our technology in this new world that we are in. So many of you know me. I'm Valerie Hillow Gates, your Executive Director of the American Heart Association here in Greater Cleveland. With so many people joining our Zoom meeting today, we have taken the liberty of muting all of the lines and limiting the video to our presenters. This should cut down on the accidental audio sounds, but we do welcome your participation by asking questions via the chat box. Please take a moment to look for your chat box so that you know where that you can ask questions. We're also recommending that you use the speaker view at the top so that you are able to see the content on our screens as well as the speakers who are talking. Today, we will be discussing the coronavirus and COVID-19, and specifically what those living with cardiovascular disease or cerebrovascular concerns should be aware of amid this ever-changing pandemic. We will also talk about COVID-19 from a public health standpoint and share the resources that we have made available as we all navigate this health challenge together. Lastly, we will be sharing more about health equity for all Americans. We'll have a Q&A session towards the end of the hour, so again, please remember to use the chat box feature to type in your questions for our moderator. The American Heart Association is deeply concerned about the public health crisis currently facing our world. Our top priority regarding COVID-19 is the health and well-being of individuals and their families today and in the future, not only here in just Greater Cleveland or across Ohio, but in every community everywhere. This is a challenging time for many of us, and we want you to know that we are all in this together. Confirmed cases of the virus continue surging, and officials are responding by setting up field hospitals, extending the state of emergencies, and approving hospitals' requests to increase bed capacity. It's our goal to keep you, the community, informed and also to provide you with support and resources available through the American Heart Association, American Stroke Association, and many of our partners during this time. On your screen, you'll see a sampling of some of the national and local media headlines related to COVID-19 and our mission-critical focuses. While we are an organization focused on heart and brain health, I thought it would be helpful to begin by sharing some of the many ways that we are also making an impact in the battle against COVID-19. First, we are investing new research dollars in the search for answers. Because of the years and years of your support through annual fundraising events like our Heart Walks, Go Red for Women and STEM, the Kids Heart Challenge, Heart and Stroke Ball, Cycle Nation, and many more, we were in a position to be able to pivot quickly and redeploy some of our budgeted dollars in the fight against COVID-19. We fast-tracked $2.5 million already for a rapid research scientific fund to allow us to investigate the specific cardiovascular implications with the coronavirus, with a goal of developing more effective treatments quickly, potentially within even the next 6 to 8 months. And for those of you in the research space, you will know that this is extremely fast. While our initial efforts to redeploy existing budget dollars allowed us to fund 10 research grants across the country, we were totally overwhelmed with an incredible 700 applications from scientists and doctors across the country. So that's 700 applications for 10 spots. That tells us the need is there and the need is real. These research grants that we will be funding are timely, relevant, and a direct way for us to help during this pandemic. We are hopeful to have announcements on who has been funded by May, and we look forward to sharing more. We're also leveraging our science and relationships with hospitals to help lead the conversation about the coronavirus and how it affects the most at-risk.
Are you still there?
Think we're getting just a little bit of audio. We are leveraging our relationships with hospitals and trying to meet the needs of healthcare workers dealing with the pandemic through efforts like ventilator trainings and the development of a free patient data registry for COVID-19, using our already robust framework of patient data for other disease types such as heart failure, AFib, and stroke. This will help with the capturing of much needed information and the creation of best practices and quality controls around COVID-19. We are teaching communities how to safely and effectively administer life-saving CPR during the pandemic, reminding people that hands-only CPR, when done properly, can be just as effective as mouth-to-mouth and is still going to be needed as we socially distance. Because we know that an average of 360,000 people will suffer from a cardiac arrest outside of a hospital setting this year alone. Everyone can learn hands-only CPR, and everyone can be a lifesaver. We're also offering CPR training tools and refreshers to hospital partners who may be bringing in supplemental help or retired workforces to the front lines who may need fast recertification. Additionally, we are advocating with federal and state governments to ensure families have access to care by supporting legislative policy like the CARES Act. Any and every time that we advocate for a policy, it is our priority to be on the side of the patient. We're meeting people where they are by providing businesses with online resources to help their employees stay healthy and active at home. Our science background has helped us develop countless resources that we can offer our community at no cost. We want to be there for you now and in the future. So again, I thank you for listening in today to learn more. It's now my privilege to introduce Kathy O'Malley Kearney, an Executive Vice President with KeyBank, who is the Chair of the Board of Directors at the American Heart Association. Welcome, Kathy.
Thank you, Valerie, and thanks to each of you for being here with us today. On behalf of the American Heart Association's Board of Directors, I want to welcome you to this important community conversation. Personally, I want to thank each of you for your support of this organization. As someone who has benefited from the life-saving science and cardiovascular advancements funded by the American Heart Association. As Valerie just shared, the AHA in a short amount of time has made a remarkable impact on the ongoing struggle against COVID-19. I am proud to lead such a nimble and impactful organization. As you may know, people with pre-existing health conditions are particularly at risk for contracting COVID-19. It's critical for those suffering from heart disease, stroke, high blood pressure, diabetes, and other chronic diseases to be diligent about taking precautionary measures that you will see outlined by our state, local, and national health experts in our own team here today. For people with underlying health issues, the concerns are serious. It appears that people over 65 with coronary heart disease or hypertension are more likely to be infected and to develop more severe symptoms. Others facing this higher risk include people 60 and over, pregnant women, young children, people with diabetes, people with serious lung and kidney conditions, and people with compromised immune systems. Stroke survivors may also have a higher risk of complications. This is why I'm proud to be a personal investor in the American Heart Association and help all of these vulnerable populations, as well as to advance the learnings around COVID-19 through these new research findings. I am also pleased to share with you that there are many ways to stay engaged with the AHA during this virtual environment we are all in. For those of you like myself with kids at home, occasionally we may find it tough to keep activity alive and everyone occupied throughout the week. The AHA has worked with parents and teachers to keep kids healthy and active while away from school. They launched a 10-day program through our Kids Heart Challenge called Cabin Fever, and it is a free resource that you can sign up for and participate right from your home. We are also offering a number of our activities and events that would have been held this spring in a more virtual forum. For example, Our Young Professionals organization is hosting a 5K run that you will track virtually, logging your miles all month and then awarding prizes. We are gearing up for our annual Heart and Stroke Ball, which will be going virtual using Zoom to allow our donors to participate in online auctions and ways to support the cause from the comfort of their own homes. We are acting nimbly and pivoting quickly to adapt to the environment we are in today. But at the heart of all of this is caring for our community. And now, I would like to welcome someone who spends all of their time caring for our community. The American Heart Association's own board president-elect, Dr. Margaret Larkins-Pettigrew, will join us today from University Hospitals and Case Western Reserve University. Dr. Larkins-Pettigrew will share the important health information that relates to the American Heart Association's 2030 impact goal, as well as the impact that the COVID-19 virus is having on those with underlying health issues and communities of color. Dr. Larkins-Pettigrew?
We will be bringing her on in just one moment. We're having a little Zoom tech fun.
It's never a dull moment when technology is involved, right?
That's right. And I see we've started to get a little bit of some questions in the chat box. I would again remind people that you are free to use the chat box feature, which is down in the bottom kind of gray bar across your screen if you'd like to add any questions or comments as we go along. So I think we may have Dr. Larkins-Pettigrew. Are you there?
Absolutely. And you can.
Yay.
Oh, wonderful. So good afternoon, everybody. Thank you so much, Kathy, for giving us such wonderful information already. It's a pleasure for me to join you today, and hopefully we'll give you a lot of information that you can use, and that we'll have a great dialogue around what the American Heart Association is now doing. So today I want to share with you the American Heart Association's brand new 2030 impact goal, something that was just launched, and we're striving for over the next decade for our work. The goal reads, together we equitably increase health life expectancy from 66 to at least 68 years by 2030. The goal begins with the word together to recognize that a coordinated effort across our nation's public, private, and nonprofit sectors is needed for success. Health equity means that everyone should have an equal opportunity to attain his or her full health potential, and that no one should be disadvantaged from achieving this potential throughout life. It is also important to both reverse the widening disparities between more and less advantaged groups in our nation, while also improving health and well-being outcomes in the absolute sense. By closing the gap between populations in health and well-being, this is the only way to ensure sustainability of health improvements for all. Increasing health life years won't be easy, as we know. So over the past decades, healthy life expectancies was increasing thanks to improvements in disease prevention and control, advances in medical treatment, and some improved lifestyle behaviors. However, recently there has been a leveling off, and in some cases, even a reversal in this trend. More people living in poor health and those risk factors are beginning at a younger age. In short, some people are getting sicker sooner, dying younger. While both cardiovascular health and death rates from cardiovascular disease have improved overall in the United States and in this past decade, disparities exist for health behaviors, risk factors, and cardiovascular death rates based on race, ethnicity, geography, and income. The 2030 impact goal aims to achieve longer, healthier lifespans for all people everywhere. While people may be living longer, not all those years are healthy ones, as we know. Health factors lead to chronic conditions that impact the quality of life in people at as many as ages younger and older, but especially now we're seeing them at younger ages. Disparities in health years exist across the United States. For example, in our community, there is a 12-year gap in the life expectancy among those that live in Cleveland's St. Clair Superior neighborhood and those who just live a few miles away in the town of Lyndhurst. The American Heart Association understands that in order to increase healthy years, we must recognize that some areas and populations have fewer healthy years than others, and we need to invest in those areas to improve health. Disparities also exist along other key areas such as race, ethnicity, income, urban versus rural settings, and levels of education. Addressing these disparities is not only critical to improving individual lives and the health of communities, but it is also critical to improving overall healthy years across the United States. Data on race, under-resourced communities, and now the COVID-19 pandemic is too limited to draw conclusions, but disproportionate health rates of sickness and death seem to be emerging, particularly among people of color. According to the Ohio Department of Health, African Americans who are more likely to have pre-existing health conditions like heart disease, stroke, diabetes, and hypertension experience adverse health effects stemming from economic, educational, and environmental factors and are being infected with the coronavirus. And they are dying at higher rates than any other group in Ohio. African Americans accounted for about 21% of the confirmed cases of COVID-19 in Ohio, despite representing only 14% of the overall population. Whites, by comparison, represent about 79% of the state's population, but account for 52% of the COVID-19 cases. From my medical perspective, I believe the American Heart Association's mission remains extremely relevant during this health crisis. Based on early reports, 40% of hospitalized COVID-19 patients had cardiovascular disease or cerebrovascular disease, which refers to blood flow to the brain, such as stroke. And also note that we are discovering that the COVID-19 virus is also increasing the coagulation properties in our bodies, which means now these patients are at more risk for strokes, heart disease, as well as damage to their spleens. So while the virus's main target is the lungs, it can also affect the heart, especially a diseased heart. And we're finding out that COVID-19 is now affecting healthy hearts. So the research behind really attacking this enemy is right in our backyard. This means we need to work harder to get oxygenated blood through the body. Someone with a heart issue may also have a less robust immune system. So additionally, we have talked a great deal in the past year about another dangerous health topic, that is vaping. Vaping refers to electronic or e-cigarettes, and usage has been alarmingly increasing over the past few years. And this, of course, is particularly with our young adults, teenagers, and even our preteens. Deceptive marketing campaigns have led teens to think this is a safe and healthy alternative to smoking traditional cigarettes. And the advertising campaigns have been predatory in increasing their efforts in low-income urban neighborhoods, again, leading to inequity in healthcare. So I say all this to share that what a terrible, dangerous combination vaping and COVID-19 are. We're losing enough lives to this terrible virus. We don't need to be increasing the loss of life because people are still vaping. Both attack the lungs and both are set up for the long-term cardiovascular impact if you are lucky enough to survive. If you have started vaping and need to quit, there are resources out there. Please don't be afraid to ask for help. As I conclude my remarks, and I look forward to answering some questions, I cannot stress enough the critical importance of following the public health guidelines around social distancing, continuing to wash your hands, wearing a cloth face mask when in public places, and taking any medication that is prescribed by your physician. During a recent briefing, Ohio Public Health Director, Dr. Amy Acton, said it is vitally important for Ohioans to not let up over the next few weeks and to continue following guidelines. She said actions taken by the state and by Ohioans have kept the state below the hospital capacity line so far, which is known as flattening the curve. When looking at Ohio compared to other states, our curve is flatter. It's important to keep in mind that many states are further along in their curves because they started seeing cases before Ohio. We cannot let up now. Most physicians' offices and hospital systems are offering a variation of virtual, internet, or phone-based visits during this time. I urge you to use these systems. Please keep up with your health care. The idea to prevent otherwise healthy people from entering an area where they may be susceptible to picking up germs. However, this does not mean we don't want you to reach out for appropriate care if you're having any kind of symptoms or medical emergency. Please, please do seek help. With that, I'm going to say thank you and welcome Lisa Wheeler.
Thank you, Dr. Larkins-Pettigrew. I am Lisa Wheeler Cooper, Community Impact Director for the American Heart Association, and I will be facilitating our Q&A session this afternoon. So just as a reminder, please use the chat box to ask your questions, and we will do our best to answer as many questions as possible. So we did get a few questions that came in advance, and so I will start with those questions. So it looks like the first question is for you, Dr. Larkins-Pettigrew. So we've talked about it being reported that those individuals with underlying health conditions are at greater risk for COVID-19. Can you talk a little bit more about how it specifically impacts heart and stroke patients?
So already our patients who have suffered from heart attacks or any cardiovascular disease and strokes are challenged with making sure that they are maintaining an intact immune system. Many times this is a challenge because of just the illness itself. So across the board, anyone who has any of these comorbidities may have a lower immune system, a system that can protect them from a common cold, the influenza virus, or anything that can affect their immune system. And so in our patients who already suffer from this disease, they are much more prone to contract the virus if exposed, and then their recovery and their ability to fight the virus off then becomes a major challenge for them. So we want to make sure that our patients who have these comorbidities are protected. So making sure that they are continuing to exercise, continue to take their medication, and continue to eat healthy as we have prescribed over the many, many years of the work that we do is the first way to start. And then make sure they contact their physicians and stay in contact in order to keep track of what's going on in their own health care.
Thank you, Kathy. It looks like the second question is for you. So as a business leader, what measures are you taking to make sure that your employees are healthy during this time?
So the first step we're taking is that virtually all of our employees are working from home. We have a contingency plan that we were able to put in place pretty much day one to make sure that everyone could effectively perform their functions at home. In addition to that, we know that there's a mental toll on being home and staying at home and not seeing your colleagues face to face. So we try to do things like this using tools such as Zoom so that we have interaction where we see one another. And we'll try to build in activities like a Zoom coffee break so that folks have time not just to work together, but to see one another socially as well. And then our organization in particular has resources for employees who may be struggling with being at home. And finally, we encourage our employees to take breaks, get out and walk, of course, staying 6 feet away from folks they don't live with, but to stay physically active as well, since that helps to relieve stress.
Thank you, Kathy. Dr. Larkins-Pettigrew, I am going to come back to you just briefly. This is connected to your first response to the first question. So there's another question in the chat box that's connected. So COVID-19, we know that it impacts the heart and the lungs. So we have one of our participants asking, are there long-term effects from those who have contracted COVID-19? Are there long-term effects on the heart and on the lung?
We are actually currently doing that research, but we do believe that there are some long-term effects, that there are some damage to tissue during those people who are hospitalized, end up intubated, and do survive, that we are really concerned that there are some significant or even minor damage to the lung tissue. So because it's such a new virus and we're still doing a lot of research, we don't know exactly the amount and the significance of the damage to lung tissue, but we do believe that there is some long-term damage to tissue that can occur.
Thank you. Valerie, I have a question for you. So you talked a little bit about how the American Heart Association is responding to COVID-19. Can you talk more about the research that's taking place that the American Heart Association is leading?
Sure. So the American Heart Association, we've always been a research centered organization. So funding medical research, which hopefully has continues to lead to breakthroughs and treatments and protocols and even cures, is a backbone of our organization. And so our efforts around funding researchers across the country will continue. Here in Greater Cleveland, I'm proud to say that we are currently funding more than $20 million worth of active research grants at local area health institutions, so something for us to be very proud of. But we've also been able to, like I said, kind of redirect some of the funds to create a new research project pool for COVID-19 specific research. So we're seeing some early indicators that those individuals going through COVID-19 may have a thickening of the heart muscle and may be developing heart arrhythmias. So that's one area of focus for the research call for proposals. So more information should be coming shortly when we're able to announce the winners of that pool. And we hope to share that with you very soon. But we are proud of the research because we know that research can lead to answers and so much more.
Thank you, Valerie. Dr. Larkins-Pettigrew, we have a few questions that have come in the chat box that are related to high blood pressure, hypertension. So those who are suffering from high blood pressure and hypertension, what measures should they take, and should they be concerned about COVID-19? So I'm just going to group a few questions that came in that are very related.
So absolutely, those who are currently have been diagnosed with hypertension should stay on their medications so they can actually control their blood pressures. However, you know that hypertension also can lead to other conditions such as permanent heart disease. So in order to not even end up in that space, it's important that you control your blood pressure and take care of yourself, even in this particular time. You are not more prone to contract the disease, but you have an underlying condition, which then means that if you are not controlled and you contract the disease, your recovery could be much more challenging than someone else who doesn't have an underlying disease like hypertension.
Thank you so much. Valerie, it's back to you. So there's a question in the chat box that one of our participants is asking the question, with so many agencies and entities working to come up with solutions around COVID-19, how are initiatives coordinated to avoid overlap and redundancy?
That's a great question. I think it's something that we're working on all the time. So this is very fluid as we progress each week. But the American Heart Association knows that we are just one of many groups that need to be together, having a seat at the table to solve problems in our communities together. And so I would say from that national or even global scale, our CEO is involved in a number of groups with other CEOs of large nonprofits and healthcare organizations. So there's lots of dialogue happening at that level to make sure that we're not overlapping or duplicating efforts. And then here in our local community, we're trying to keep in really good touch with all of our local partners as best that we can to figure out, you know, what we can add and how we can be a part of the solution, where we can fall back on our strengths. Our science and our hospital relationships and our corporate relationships are among those strengths and what we can offer, but certainly, you know, do not have an interest in kind of wasting efforts or duplicating efforts. So it's a great question and one that we're continuing to keep at our forefront as well. Just like many organizations across the country, we're looking at how we can tighten the belt on our expenses as well and make sure that, you know, our budgeted dollars remain as mission focused as we can at this time and always.
Thank you so much. So I will just remind everyone to continue to use the chat box to ask questions. We have a question that's really asking about the use of the face mask. So Dr. Larkins-Pettigrew, from your perspective, the face mask, and you talked about washing your hands, can you give your thoughts about just proper ways that we can all, or measures that we can all take to protect ourselves during this time? And if you can specifically speak to the mask.
So as far as the mask is concerned, anytime you are out in a public space where there's other people around, you should have on a mask. It is really to protect you from infecting someone else. The issue is that with a face mask and being 6 feet, the distance of 6 feet away from another, the spraying of your saliva, which also is airbound, then it also can cause you to inhale as well as spread the virus to someone else. So whenever you're in a public place, whenever you are in a group greater than 10 people, you need to have a mask on. So I am encouraging everyone that if you're out and about and you're going to be in a space where other people are, you need to have a mask on at all times. We know that a typical mask that covers your face, and even if you wear a bandana around your mouth, does protect you from getting a lot of the actual spray and spraying a lot to other people. They're very different than what we would use in the hospital setting, but it also has been shown to decrease the spread of the infection, which is why all of us are doing what we need to do, staying home, being safe, and those masks when we go out to public places. And that's everyone. That's your children, anyone who's going out with you, they need to have a mask on as well. And again, I emphasize that you need to continue to wash your hands. Make sure that you wash all of your surfaces off, your counter surfaces, as you go throughout your day, especially if people are coming in and out of your house. And just make sure that you're trying to be safe.
Thank you. So I'm going to stay with you for a minute, Dr. Larkins-Pettigrew. So we've heard some initial recommendations or conversations from some of our state leaders about lifting some restrictions in phases. And so we know that right now, this is a season where people are out and about in sports activities, physical activities. So as these restrictions are being lifted, we have a participant that is wondering how is that going to impact playing sports, indoor and outdoor sports, and then shared equipment. So what types of things should parents and others be concerned about when it is the time to go back into some of these environments where there could be some high contact through sports and other activities? So I know this is all very new and there's not a lot of research, but that's one of our participants is wanting to know what your perspective is on that.
So this is a new virus, the COVID-19, but we've had viruses in the past that have taken us down the same road. This is the worst that we've ever had an effectivity in our country and throughout the world. And but there are very systematic ways that we need to control our behavior in order to not spread the virus and to have reinfections as we go along, which is outlined by the World Health Organization, as well as our government or agencies around healthcare, as to how we need to very slowly go back into opening up any of the things, which is going to be our new normal, but doing some of the things that we're used to doing. For instance, a couple of the things that they have emphasized is testing. So we have to make sure that available testing is for everyone, and I mean everyone, because we have the virus that can shed, and you can have asymptomatic shedders of the virus. And we know that that can happen sometimes 14 days or longer. So the first thing is that we need to be able to test everyone, because if you're an asymptomatic shedder and you are going out and you're playing basketball or anything else with other people, then you're going to make sure that the people will be infected. So the issue around testing is a big deal. I know we hear there's a lot of political pull and push about this, but if we cannot test everyone, then we don't know where we are as far as it relates to who has it, who doesn't have it, who's an asymptomatic carrier, et cetera, et cetera. So as we increase the amount of testing and we know where people are and we know how we protect one another from shedding the virus, then we begin to open up many of our businesses, begin to play ball again, et cetera, et cetera. But it is really important that we have the infrastructure within our own country, and this is nationwide, to do widespread testing on every single individual. And so I know people are moving in that direction. I know as the state of Ohio, we're moving in that direction, and we're trying to make sure that we have the capacity to test those who are not even know that they've been exposed. But that's where we need to start. And based on having that ability, then we can figure out where it is prevalent, where are the hot spots, and how we can then loosen up the restrictions to move around as we are used to.
Thank you. It looks like we are coming to a close of our questions, but there is one final question in here, and we talked about the face masks. We've talked about washing our hands, and someone is asking for you to give your thoughts on eye coverage. So we've seen that our medical professionals have face shields on, but for the general public, do we need to be concerned about coverage for our eyes?
No, but you have to keep your hands off of your face and out of your eyes. The issue why healthcare providers have their entire face covered is because we have a tendency to touch our face and to use our hands like we usually do every single day. So for the lay public, it's just to make sure that you cover your mouth, cover your nose. That's all you really need to do, and keep your hands off of your face. So there has been nothing that has been, this is airborne. It actually attacks the lungs. It gets into your respiratory system. There is nothing that's going to happen with your eyes unless at all. So it's not important for you to protect your eyes.
All right, thank you. So I know this is more, so someone's asking about any concerns about restrictions being lifted and just making sure that folks are safe. And I know that our state, local, regional health officials have been saying that this is going to be a phase-in approach. And so on May 1st, we're not going to turn a knob or flip a switch and everything is going to go back to how it was pre-COVID. So can you talk a little bit about your thoughts about the conversations that are happening about lifting restrictions?
Mm-hmm. Well, we can't stay inside forever. So at some point we're going to have to lift restrictions, but they should be done in a very gradual and strategic way. We have to make sure that we are protecting ourselves, protecting our families. And if we move forward and actually open restrictions too fast, we are going to be right back into this vicious cycle where many people are becoming ill, hospitalized, and we're going to overwhelm our hospital systems again. Ohio is leading the way. We are doing the right things. The American Heart Association is right up there with this drive to make sure that we want everyone to stay safe, especially those who are already affected with some cardiovascular and lung disease. but if we need to do it in a very strategic way. So I know our economy is at risk for not opening very quickly, but our lives are at risk. Our families' lives are at risk. So we need to do it in a very slow, strategic, meticulous way in order to make sure that we're all going to be safe. So we're in this for the long run. We have to really pay attention to what our leaders are telling us, especially our health leaders.
Thank you so much, Dr. Larkins-Pettigrew. So Valerie, I have a question for you. So what types of resources are available to educators to use in the classroom for students to educate them about what's going on right now?
So our educational resources are continuing to evolve. So I will predict that we will continue to have amended versions of those as things move forward and as additional announcements are made around the educational space. But I can tell you right now, we have a wealth of information that can be used for students at home, as Kathy mentioned. So for parents and students to be doing together, it's called Kick Cabin Fever to the Curb. And it's a 10-day online challenge that you can participate in. And it encourages things like physical activity while you're inside, staying healthy with eating healthy foods, and just really that focus on kind of the whole child, the emotional health. I think as we move forward, the American Heart Association is proud to be one of the only organizations that's been inside the schools with feet on the ground in the schools for close to 45 years. And so we have deep relationships with educators, many times in the health and physical education space. And we work with a lot of superintendents and principals as well. So I think we will be adapting our resources to make sure we can address things like your question around, if the social distancing is the new normal and how we stop the spread of germs, that is our new normal. And so how can we help with a voice around that in our educational materials? We've always been one who have been able to have our materials be curriculum centered and really aim to be a helpful resource for teachers, parents, and students alike. So I would say that we will continue to adapt and adjust to make sure that we're meeting the current environment needs.
Thank you so much, Valerie. So we have one last question that we'll take from the chat box. And Dr. Larkins-Pettigrew, I know this is very new, but if you could just give your thoughts on the vaccination. So we have someone asking about the vaccination, and if, because we are in such, the United States has robust resources, and wanting to know your thoughts on the vaccination. And we've heard a time frame that this will happen in the next 12 months. So do you have any insights about the vaccination and what your thoughts are from your medical perspective?
So we know there are many experts throughout the country working as fast as they possibly can to develop a vaccine. Usually it takes about a year for a vaccine to be developed. And that is because we have to figure out specifically how the virus works, what's really the genetic engineering that has to go into making sure that we have a vaccine that's going to prevent recurrence of the illness. So the issue is that we will not have a vaccine as quickly as we would want to have one. But we are working much faster than we have ever done before. Many multi-center trials are going on to develop a vaccine. But in the meantime, most of us and many of us will be infected with the virus and develop some of our immunity by ourselves, which will then protect us. But until then, in order to protect our entire society, we do need a vaccine. And that is why we're working very hard. So absolutely, in order to produce something that is efficient, effective, cost effective to cover the entire world, because we're not in this alone, we need to work very quickly, but we need to work very smartly. And so everyone's doing everything possibly can to make this happen.
Thank you so much. And we've concluded our Q&A session. So I'm going to give our speakers an opportunity to provide some final thoughts to the audience. However, I wanted to point you to a few American Heart Association resources that we have available. So you'll see some representations on the screen. There is more information available on our website at heart.org. So there are a variety of tools and resources that are available for you and your family to help keep you healthy and active during this time. So visit heart.org for some additional resources. So now let's hear final remarks from our speakers. So I'll ask our speakers, what message do you want participants to take away from today's conversation? And so Kathy, I will start with you. What do you want folks to take away from our time today? Kathy, it looks like you're on mute. All right, Dr. Larkins-Pettigrew, what do you want folks to take away from our conversation today?
We use this very frequently. We're hearing it on television all the time, this whole thing about togetherness and we're all in this together. Please take that to heart, that what you do, your behavior is going to affect what happens in your family, what happens in your neighborhood, what happens in your city, what happens in the world. You really must think about your behavior as it relates to protecting everyone. So even in the crisis of knowing that there are some people who need help, people who are not being able to pay their bills, we need to make sure we are together in all aspects of protecting everyone from the virus, but also taking care of our neighbors. So when I'm walking away from this, I want you to know that I am just so very grateful to all of our health providers who are on the front line, but there's a lot of other people on the front line too. Many of our officers, are people who protect us every single day, but you must think of yourself as a frontline provider as well, that you are taking responsibility for everything that you do to protect everyone around you in your entire community. So with that, continue to work very closely with the American Heart Association. We're going to work very closely with you to make sure that we are looking out for you, and we hope you do the same for us.
All right, Valerie, what do you want folks to take away from our conversation today?
Okay, well, most importantly, I just want to say thank you to everybody for taking time out of your day to be with us. It's clear to me that we have a lot of interest and a lot of questions. And so I do want you to know we are recording your questions down so that we can continue to try to provide answers and continue to discuss with you in new forums and new conversations. Some of you have asked in the chat box if you would be able to get a copy of the presentation or how to get a link to any of the free resources we talked about. So I would like you to know that yes, we will email you out some information afterwards that we would like, one, your feedback on our first attempt at this. So pardon our technology as we learn. But two, we would like to share with you some links to resources, and then also we would be happy to share the slides as well. So wanted to make sure everybody knew lots of information available to you. My team and I are happy to get that out. Additionally, from all of us at the American Heart Association, American Stroke Association family, please know that everybody who has a significant role on the front lines in any way during this crisis is in our thoughts, and we salute you. You are our heroes. So that includes all of the healthcare workers, the respiratory therapists, the nurses, the docs, everybody in the healthcare setting, but it also includes everybody else in the world who's trying to keep us powered and keep us connected and deliver our mail and our packages and keep us well stocked at the grocery store and so many other things, the teachers who are inspiring us and so many more. So we thank you. You are the heroes and we are with you today. I would encourage everybody, if you are not following our social media pages yet, we would like to ask you to do that. That is a great way to stay informed and get information the quickest from us relating to breaking news or free resources. So our Facebook, Twitter, and Instagram handle is the same. It's at Cleveland AHA. So again, that's at Cleveland AHA. We would ask you to give us a follow so that we may share information as timely as possible with you. So in closing, please stay safe, stay healthy, stay connected in those ways that you can. And we are going to end our session today with a brief video clip. So I will go ahead and say goodbye to all of you right now as the video loads. Thanks, everyone.
All right. Can you hear me? No.